Well, good afternoon, everyone. Good afternoon, Dr. Etienne. Good afternoon, Katia Fleur. It's such a pleasure to have both of you tonight. I'm so excited so we can just have a conversation with the residents of North Miami about two C's, um, the census and COVID. So, Katia is a very dear friend of the community, very dear friend of mine, very active young lady in our community, and is very passionate about the census. So I look forward to having to starting out with our dialogue with you, Katia. As we all been preaching and telling everyone, we need to complete the census. We need to do the census so that it can better our communities on various reasons. So I'll open up the floor to you and for you to give us some nuggets on what we can do here in North Miami and how we can encourage the residents of North Miami in District 3 to really take this census seriously. I'm unable to hear. Can everybody hear?
If you could go to the next person, we're fixing it, Councilwoman.
Okay, sure. So let's start with you, Dr. Etienne. Are we able to get you on?
So it must be the storm. There's a storm where I am. So it must
okay,
be
I can hear you now.
Okay, hi.
Definitely hear you now.
Yes, absolutely. Hi.
So if you wouldn't mind and introduce, so go ahead and introduce yourself so that the people that don't already know you in North Miami, and I don't know who that is, you can just reintroduce yourself to the community, please.
Okay. Yes, good afternoon, everyone. This is Marie Etienne. I am a professor of nursing from Miami-Dade College for over 20 years. And I teach nursing in the RN to BSN program. And so I am the president and CEO of Global Innovative Foundation. Everybody knows we've been doing a lot of work in the during COVID-19 to educate the community. I'm a past president of the Haitian American Nurses Association of Florida. I am the second vice president of the Miami Black Nurses Association, as well as the director of nursing for the director for South Region Florida Nurses Association. And currently I am the president of HANA International.
Congratulations.
Yes, the Haitian American Nurses Association has 10 chapters. 11 chapters in the United States. And so now we call ourselves HANA International. So other entity can join, nursing entity, of course. And so I wear many hats. I know when to get a hat off. And thankfully, God has been gracious to me. And we're here to talk about the pandemic.
Yes. And Katia, I'll give you a chance to introduce yourself before you get into your census talk. And you're muted. We're still unable to hear you. Okay, so Dr. Etienne back. Ms. Cadeau, Dr. Cadeau, I should say. Could you go ahead and introduce yourself?
Hello, everyone. My name is Dr. Cadeau. I'm a full professor at St. Thomas University in the School of Education, and I work in partnership with Dr. Steve Gallen, and he told me to make sure that I'm here and he said he supports you all, and I'm here representing him too.
Okay.
That's it about myself.
Okay, well, thank you so much for your presence. So Dr. Katia, can we get to you anytime now?
Can you guys hear me now?
Yes, we can.
Yes,
All right, so
We
let's
can
do
hear
it.
you.
So go ahead and introduce yourself, Katia.
My name is Katia and Fleur. Like you said, I wear many, many hats, and I'm super excited to be here today to talk about my favorite thing to talk about right now, which is census and making sure that everybody gets involved. But first and foremost, I want to thank the city of North Miami for the incredible work that you guys have been doing, in part because of your leadership and a few other people. But the numbers in North Miami are not where we want them to be. But know that in some of the parts of North Miami, the numbers are very, very high, particularly in your district and Councilman Deslamai's district. We are showing some really good numbers compared to what we did in 2010. I want people to continue to do the work that they've been doing, encouraging everybody to participate. And we'll get into a little bit more about the census as we go on, but I'd be remiss if I didn't say that North Miami has really put forth an amazing effort. The Census Bureau has been working with Summer, and I forgot the other young man's name, and they've just been doing a fantastic job. There's nowhere you can go in North Miami where you don't see census, but there's still work to be done.
Absolutely. So let's just dive into this whole census. So basically, can you just remind the community, what are the benefits of filling out those census? How does it benefit me as a resident that's looking, a District 3 resident, or North Miami resident, or just our community in general? What is the benefit to me of filling out this census?
So if anybody's been living under a rock for the past year or so, the census, and if you have, it's okay, right? So the census is essentially a head count of every person living and breathing in the United States. The Constitution mandates that we have a head count every 10 years for the purpose of reapportionment and for the purpose of a population count, right? So when I say reapportionment, I mean we need to know how many people are who gets how many congresspeople in DC. So it's for representation and it's for money. That is the part that we all are interested in, right? Is the census dictates how much money comes back to the city of North Miami. So, ça veut dire pour mon capitaine qui parle créole, mais n'a parler anglais. So, recensement 2021, c'est pour nous connaître combien de ressources nous portons dans notre communauté. Faut que nous comptons tout le monde qui est dans North Miami, même si vous ne parlez pas l'anglais, même si vous n'avez pas de citizenship. This has absolutely nothing to do with citizenship. We'll talk about that shortly. But nous besoin que tout le monde compte parce que tout le monde besoin de ressources, tout le monde besoin pour Councilwoman Estimé aider nous. So these numbers, numéro ça, le compte que tout le monde qui était là, c'est compte ça que citoyen qui a aidé nous. Si citoyen n'a pas joué un corps, il va pas aider nous. So le fait que nous avons aidé citoyen jouer un corps, c'est that's the best thing that we can do for the city of North Miami, is making sure that we enable you guys to do your job by getting a full count.
So just to make this a little bit more personal, on the city level, if I live in the city of North Miami, how would I see those dollars manifested in the city of North Miami?
In the city of North Miami, you would see those manifested, and how many teachers and how many resources you have at the school, your parks and recreation, the fact that the city has the CRA, CDBG funds, the roads, the number of healthcare providers that you're able to have when you go to the local hospital is based on census dollars. Right now, we're in a global pandemic. When they are talking about sending money and resources to the city of North Miami to help with the pandemic, they're looking at census numbers. How many people live in North Miami? How many gallons of water do we need to send when there's a hurricane? Do you know what I mean? How many Band-Aids we need to send? How many diapers we're going to have to send? All of these things, just about everything that you do when you leave your house, when you're in your house, is based on census numbers. You know, when you get on the road and you're like, oh, this road, we don't know when it's going to be fixed. That's based on how many people they estimate are going to go up and down these roads. Those are census numbers. When you say, oh, we live in a food desert, we don't have the right type of grocery stores, we want more, we need a Walmart, or we need another Publix or another Winn-Dixie. Those are based on census numbers. Businesses look at the numbers of every population so that they can project where they will be able to, of course, have the best profits. And if those numbers don't match the needs, then they don't get those types of resources. There's very little that we do as a community that doesn't go back and isn't tied to census numbers. Even the program that the city of North Miami has where you guys help people fix their homes.
And we just, and a lot of us just benefited from that. A lot of residents in North Miami actually qualified for the rent relief program that we've had, and also some CDBG monies that were allocated for this COVID pandemic. We were able to use that as a relief fund. So I hope that in listening, nous souhaitons que pendant que nous attendons message ça, I'll try to say it in Creole as well, que nous réaliser importance et recensement, c'est extrêmement important que nous fassions, qui gens que l'affecte nous-mêmes qui habitons dans la ville, l'affecte nous parce que l'affecte l'argent que nous recevons. Si on connaît 10 personnes là, il y a l'argent pour 10 personnes. Et si il y a 50 personnes, il y a un service que les gens ne peuvent pas joindre. So it's really, really important, like Katia has been saying, about completing the census or recensement en Creole. Any
So
other
thank you
thing?
for doing that, because you know my Creole is shaky.
And so is mine. We're trying. Thank God we have Dr. Etienne to do any correction that needs to be done.
Oh,
right?
that's our queen of all.
Or Dr. Kado.
The work that Dr. Etienne does, and I sit on the board of Global Hope, so I am a proud member of, and I'm a first and foremost, I see the work that Dr. Etienne does. So I have to say that she's a jewel, not just to our community, not just to Miami-Dade County, not just to the city of North Miami, but really she is a jewel to the Haitian community and all communities globally. The work that you are doing, you know, I believe in giving flowers where people are still living, and Madame, Dr. Etienne, you get all of the flowers. The work is amazing, and we need more Dr. Etienne's that also lead the path for other people. But I want to go back to saying that you can still fill out your census form.
Yes.
The Census Bureau is going into a different operation right now, which is called non-response follow-up. So people are going to start knocking on your doors. And if you don't want anybody to knock on your door, it's imperative and it's important that you go online and you fill out the census form. And you can go to my2020census.gov and you can do it now. It's never too late to fill out the form. Si probablement soit support ou demande question, you can still do the census form. Pour contour, you can go to my2020census.gov. Again, we have a number that you can call where you can get assistance in Creole. It's 844-477-2020. There's also an English number. I will post that on this chat in a bit, and you guys
And
can
if you
share
can
it.
give a Spanish number as well, too.
I will definitely give you guys that. Definitely, si que nous pouvons faire le recensement 2020, please know that gen temps toujours, parce que gen moun kap vin pour support, because the information has to be collected. I'll say it in English. If you have not done your census form yet, your questionnaire, there is still time. We are in what we call non-response follow-up, where people are going to be knocking on doors and getting, because the Constitution requires and mandates that we count everybody. So during this time, which has been the longest period, because of COVID, it's been the longest period where people have had the opportunity to self-respond. So let's take advantage of it. Let's get people counted. If you know you've been counted, call a friend. Hey, have you done the census? Send a text message. It's each one teach one. We all live here together. We get one shot at getting the census numbers right once every 10 years, and we will have to live with these numbers. So it isn't just they'll figure it out. They will not figure it out. It's like you said, if the need is 50 people and you have only counted 10 people, the city will only get resources for those 10 people.
Yep. Now, we talked about, getting resources dollars here for our community, for schooling, for roads and all that. What about political political power, or can you touch on that a little bit?
Absolutely. I'm glad we got here. So representation matters. So there's something like I briefly stated, reapportionment. We do redistricting. And the way that redistricting work is it's based on population. They say you look at, depending on the seat or whatever they're trying to draw for, say if we're drawing for a school board seat, if we are drawing for a congressional seat, if we are drawing for state representatives, senator seats, they do those based on how many people live in a geographical area. So if you have people in this area that are not counted, then you're not counted in the way that they draw the maps. And the maps are drawn after every reapportionment, meaning after every census where they get the numbers, they draw these maps. And the more of a community is counted, the likelier it is that community will be able to have representation. And I want to say about 1990, the reason that we were able to even have some representation that looked like everybody on this Zoom right now is because we had successful censuses where everybody was counted. So as a growing community, we should definitely make sure that we are counted so that we can continue to have the type of political representation that we need, not just locally, not just at Miami-Dade, not just at the city of North Miami, but also in Tallahassee and also possibly in Washington, D.C. one day. So the more that we're counted, the more likely it is that we're going to have proper representation.
All right. All right. I think that we've touched on all of the census points that we can touch on. So before we get, well, we're probably going to interchangeably talk to Dr. Etienne and Dr. Cadeau because they're going to both have to answer questions. So it's obvious that Katia mentioned that we are in a pandemic, global pandemic, and we have not, here in North Miami, we have not escaped that. As of the 17th, we had 1,078 people that were affected by COVID that were positive, and we had 7 cases out of those. So it is affecting we are affected right here in North Miami. And I say this, that when the pandemic initially hit, the first case of fatality was right here in North Miami in my own district, if I have to really be frank. So let's just talk about COVID. Are we still in this panic mode? Do we still have to pay attention like we were? I mean, are we shut down? School is about to start. Like, what should we do? What should we not do? What should we do? And what should we or continue to do? I can't hear you, Dr. Etienne. You're muted.
Thank you, Councilwoman Irvin, for inviting me to share some of this important conversation about COVID-19. We are in a pandemic. The pandemic still exists. The thing that we need to make sure everybody knows is that no, you're not going to panic, because what we're going to do is face reality. We're going to make sure that we protect each other, understand what needs to be done, adhere to the rules of the local officials, making sure that we follow the guidelines that have been set by the Center for Disease Control, as well as the World Health Organization. We want to make sure that we encourage everyone to continue practicing the social distancing from 6 feet. Make sure that you wash your hands very thoroughly, at least 20 seconds with soap and water. Make sure that you know the symptoms. And if you have certain symptoms, you need to make sure that you notify your healthcare provider. And I want to reiterate the importance of you protecting not only your neighbor, but also protecting your family, especially if you have.
Before you go any further, you mentioned social distancing and you said know the symptoms. Can you go over with us what symptoms should pay attention to? Are there any new ones?
There are new ones, and they have identified. Of course, there are a lot of research going on. The data is very fluid, and as of today, I was looking at Miami-Dade County with more than 148,000 cases. Confirmed cases, and 2,166 deaths. And so we know this is real, and the city of North Miami is impacted. The symptoms that we need to look for, if you're having any cough, any shortness of breath, if you are feeling feverish, meaning if you have a temperature that is 101 or above, la fièvre, si nous gen la fièvre, n'a toussé, nous pas senti nous bien, nous senti nous gen fatigue, if you feel fatigue, if you feel nausea, even if you feel nauseous, ou nausea, ou vle gen diarrhée, even diarrhea now, nou wè ke yo additionné a sore throat. You know, longtemps nous kon ap di, mais sou gon ti goj wap fò mal, c'est pas COVID, c'est peut-être gon infection respiratoire, upper respiratory infection. But now the guidelines is clearly in cdc.gov. It tells you that if you are having shortness of breath, if you're having fever, if you're having difficulty breathing, if you are having diarrhea, if you feel muscle pain, if any of those symptoms that you are feeling, you need to contact your primary care provider. Most importantly, you have to quarantine. You have to stay the 14 days at home and protect yourself. Stay in a separate room. In a separate room, do not share any dishes. Faut nous être dans chambre privé pour nous pas servir à même assiette avec même godet avec moun, gobelet, c'est-à-dire pour nous connaître symptômes, pour nous protéger famille nous. Surtout si nous avons grand monde qui est là avec nous. Protéger les grand monde, protéger les moun parce que immune système yo antigen est weak. Et so nous avons besoin d'assurer que nous protégeons.
Okay.
Mm-hmm.
Okay. Mm-hmm.
Vous voulez me continuer? Vous voulez continuer toujours?
Please continue.
Ok, so, il y a un peu de monde qui toujours est peur pour quitter la caille. Même pour sortir dans la rue, il y a peur. Je dis nous que, mais moi, je suis un qui a foi un peu, je connais bon Dieu. Je connais bon Dieu occuper tout le monde, mais il faut nous prendre des précautions. Soit dans le supermarché, là, ou paraître, et puis, premier bagage vous fait, vous prenez une carte, vous prenez un shopping cart, vous allez shopping. Mais il faut marcher avec un petit désinfectant pour nettoyer main, pour nettoyer manche et bourrette là pour pas le pousser. Et nous t'avons dit nous tout. Il y a pile monde qui dans grocery stores, et dans shop et elle fait market. Et puis m'a regardé monde, il a ouvert sachet raisin et puis a mettre mayo là-dedans pour goûter. M'a suivre ça. Moi monde fait ça tout le temps. Me dit oh, yo par contre combien de monde qui moyen, yo par contre combien de monde qui touche. Si vous acheter un raisin, faut le fermer. Faut le fermer. Faut nous connaître que moun yo les al dans market y a payé moyen ça et puis mettre là. Si mon pas propre, ou contaminer bagay là. Moun si on l'autre moun te contaminé ou contaminé même pas. Imaginez que ou à peine saute dans shop là et puis ou passer dans drive-thru ou dans McDonald's ou pas laver main ou juste prendre manger ou mettre dans bouche. Tout ça c'est important pour nous là pour nous gagner hand sanitizer pour nous nettoyer main nous avant nous manger. L'eau saute dans la rue et rad sale sous premier bagage gen moun qui fait retirer ou bien mettre laver ou bien retirer soulier en dehors. Parfois longtemps qu'on a dit pas mettre soulier dans carpet moi et puis nous qu'on a dit oh c'est bon de faire pourtant qu'on y a li très important pour nous protéger tête nous protéger caille nous protéger ti moun nous et li très important pour nous protéger manger que n'a manger en tout parce que nous pas vle gen poison manger qu'on bail poison si li pas est traité normal. OK, grand pile domaine que nous ka moyen soit fait COVID-19 non parce que kounya gen moun qui COVID non yo pas gen symptômes. Gen moun qui gen virus là yo pas gen symptômes. Yo asymptomatic et moun sa yo dangereux parce que wap marcher côté yo pas connaît vraiment si yo gen symptômes. Mais si moun nan dit ah oui comme pas bon même non doc on dit oh ça gagne tout comment fait mal mais qui ça encore te gagné parce que nous-mêmes nous toujours dit ah m'bral batité moi m'bral font tité là et puis tout bagage you know m'sot font tité aussi là correct mais faut nous communiquer symptômes yo avec et docteur nous nurse practitioner nous et physician assistant nous n'importe provider ko gagné faut checker avec eux. So
now let's say all of that in English, Dr. Etienne.
Oh. It is so important for you to know the symptoms. And I just mentioned so many symptoms, and I mentioned that if you know you have a sore throat, before when we used to say, oh, I have a sore throat, you used to think, oh, maybe it's just an upper respiratory infection. Now the CDC, the Center for Disease Control, has added sore throat, diarrhea, nausea, vomiting, and on the list. It also adds fatigue, muscle pain, And remember, the very primary symptoms that at the beginning we talked about were shortness of breath, having difficulty breathing. And if you have a fever of 101 and up, that is not good. You need to, you need to write down those symptoms, call your doctor right away. And that is why you have a wonderful councilwoman who is addressing the issue. I must say, I'm very proud of the city of North Miami. I have been receiving all of the communications about the CDC guidelines, the how to protect yourself, how to protect your home. I mean, kudos to all the commissions and all the Mr. Mayor, and as well as all the councilwoman and councilmen in the city of North Miami. And I'm very proud to share this platform with you this afternoon.
So
and I also mentioned, if you go to the grocery store,
yes,
and the first thing you grab a cart, and you didn't bring any hand wipes, you didn't sanitize your hand, and so you just grab the cart and you walk through the store, and you touching things without your hand being sanitized. So it's important for you when you go to make sure you wipe your hands, wipe the cart handle, and if you're going to get groceries, like for example grapes, we know many individuals. I see some people, they go and open a grape a bag, and they're tasting a grape without even washing it. They actually touching all of the fruits and vegetables, and put this here, touch this here. Just be mindful when you go to the store. Make sure whatever you buy, make sure that it is sealed, make sure that it is closed, and make sure that you protect yourself, because we don't want you to get food poisoning. Because if the food are not being handled properly, you can get food poison. And also, I mentioned that you have people who are walking without symptoms of COVID-19. They are asymptomatic, so they look like they don't have the virus, but in reality, they may have the virus. And so that is why they tell you, wear your mask. Just imagine a nurse wearing a mask for 12 hours, taking care of patients. So you were wearing a mask for 15 minutes. I can't wear the mask. Yes, you can. Yes, you can. Yes. Get your cloth mask. Make sure that your mask has 3 layers, 3 cloth layers, that it's sealed, it's cover your nose, cover your mouth. Don't put it right here and don't cover your nose. Make sure that it's completely. And, I'm going to just quickly just say, a lot of times people, they you make sure you put your mask on, okay? You make sure you put the other side on, and you make sure you seal the top. You see, you make sure you seal the top, you bring it all the way down, and you close your nose and make sure that everything is closed. So when you go out there, you feel secure, you're protecting yourself, and you're protecting your neighbor.
So we're gonna have to run to Dr. Kado, but right before we do talk to the professor about school, what advice do you have for parents on how to advise their kids, or if there are any kids watching right now? What are one or 2 or 3 words really quickly that you can advise them on how serious the COVID is, and that they too are not necessarily immune from COVID?
You talking to me?
I'm talking to you, Dr. Etienne.
Really? Oh, yes. Children are wonderful. They love to play. They love to hug, immediately. And so we need to have a conversation with our children. I am going to advise every parent who has a child who's getting ready for school. Right now, we know they're homeschooled. And so I was very impressed today by seeing something one of my colleagues did. She actually took a board, and she, just like the child was in school, she put the board, welcome. These are the positive words. You will do great. You will be successful. You're going to be wonderful. Today is the first day of school. Yay. They put, just excitement. The children feeds into the parents' energy. So it's important for the parents to be excited about going back to school. If you are claiming that I'm depressed, guess what? Your child's gonna feed into that. So it's important to have conversation with your children, have a family meeting, bring the family together and says, okay, we have to have a family meeting. And I used to do that a lot with my children. And you have an agenda. I mean, everything is about an agenda. I have an agenda. Today, we're going to talk about back to school. And let's talk about, first of all, how do you feel about going back to school? What's bothering you? You need to allow the child to ventilate their concerns and their fears. And you have to learn to listen to your children when they say they don't feel something. They may not be feeling good too. So you need to make sure you know that they're not sick. That's the first thing. You need to ensure that, let them know that this is a new normal, that this too shall pass. You know, you can't say, oh, this thing is never gonna go away. No, this will go away. But at the same time, these are the things we're going to do in the meantime to protect you and to make sure that you are learning. Okay? We're gonna make sure you put in an environment that is clean for the children so that they feel safe and free, so that there's no clutter. They have their notebooks, their notepad, which I was very impressed. You know, the city is going to give backpack to school and all that great things. And so I'm excited about that. So everything, make sure that your children have all the necessities that they need so that they can be ready and that they feel comfortable. And allow them to write down their thoughts, allow them to ask questions, and you know, show love and be energized around your children, because they need you. They are anxious just like you are. Do not feed your anxiety into your children. Please love your children.
Thank you so much for your thoughts, Dr. Etienne. So
Yes.
Dr. Cadeau, as far as we know, we're in phase 1. August, school's going to start August 31st. Maybe there are talks that it may not start. Are the kids going to be there physically? Is it going to be virtual? Could you just enlighten our parents? I have the opportunity to serve the beautiful District 3 of the great North Miami, where I actually have 3 schools in my districts. I have North Miami Elementary, I have Art Creek Elementary, and North Miami Middle. And so if parents are listening, what advice and you know, what should they expect this school year? You know, how should our students prepare for school this school year? So could you go ahead and give us a little bit of that?
I did not know I was going to speak, but
well, you're representing Dr. Gallen.
I said, let me just go by. Well, first, Miami-Dade County Public School has gone virtual. So students are home. They, and everything is done through Canvas and online. However, students are used to having the teacher there with them. So this is a learning curve for us. But obviously we started since March. So the main advice I want to give, especially the parents, is if they feel that, especially because I had one parent that contacted me and she's like, I don't speak good English. How am I going to help my child? They're concerned about the content. And the district has support for that. And you can always contact your administrator. And mainly the administrator must become engaged with the school and the parents and the community in order to provide preventative behaviors, even if they're home. But at the same time, there's a mental part, emotional part, I think, that comes with this. Because there are students that say, well, it's too much work. They're not used to learning like that. Although our millennials and our post-millennials are used to using the computer, but learning online is a learning curve. So we want to integrate a migration of strategies into the curricular and extracurricular activity in learning, distance learning. And that's, I don't know if that's giving it good advice, but you know, having a healthy environment at the home and their work, station place. This morning I saw something on Facebook my sister-in-law posted, but she was a teacher. It looks like his area, the whole area looked like he was actually in class. So he was enthused, he was ready to learn, you know. So the main thing is to make decisions and take account into the different community transmission and get parents, tell parents, give parents the different resources that's available to them to help them teach or help them help their kids. Because even though they're going to have a teacher online, but the parents feel like they're more involved now, which is kind of a good thing, you know. So now they know the importance of teachers. Is that what you're asking?
Well, that's fine. Well, thank you for being able to answer a couple of questions for Dr. Gallen. But we are, just for anyone watching, Dr. Gallen and I are going to have a talk coming up soon, and also Dr. Dorothy Bendros Mendengal, which they're both representative of my district. So we'll be having more in-depth conversations about the reopening of school, about how parents involvement. A lot of the concerns that we have is that some parents are not technology savvy. And you know, how will they be able to aider ti moun yo l'école avec devoir yo? And that's both in the Haitian Creole family or in the Spanish English family, which we have a large Hispanic, a growing Hispanic population right here in North Miami. So that's going to be a conversation that everyone that wants to tune in next Councilwoman talk that we have next week, well, we'll be talking to both of our school board members on on what is expected of both the parents and the student for the upcoming school year.
I know for a fact that Dade County, they also provide computers, laptops that they give to the parents for those who do not have it. You know, they are, as you said, some parents are not computer savvy, and they provide resources to help with that. And I
Right,
guess,
and so we want to talk about those challenges as well with the broadband access and all of that. So that'll be very interesting. And I know that Miami-Dade Public School is doing their very best to make sure that our students are able to survive through this time. I also want to, I just really want to take the opportunity to thank all of you ladies for being here and for having this talk with the residents of North Miami and everybody else who's listening who this benefits on the today were the 2 C's really. We kind of did a little preview of what we're going to talk about next week in terms of back to school. But thank you, Katia, again, for your knowledge on the census. Thank you, Dr. Etienne, for explaining to us with such passion and understanding on what we need to do to survive this COVID. And Katia, thank you for standing in the gap for Dr. Gallen. So I appreciate you, wonderful, strong women of the community, and thank you so much.
We appreciate you, Councilwoman. You're doing an amazing job in the city, in your district, and they're lucky to have you.
Thank you. Thank you.
I echo Dr. Etienne's sentiment. Thank you.
And you know, with Katia is our legislative person in governmental affairs for Global Innovative Foundation. We here, right here. We everywhere globally, but you know, our heart is right in the city of North Miami. Yeah. And I don't want city of Miami Gardens to be jealous, but you know, they know I love them, and all the other cities. But you know, we're here to serve and empower individuals about different issues in the community. Thank you.
Absolutely. And if you haven't, again, please fill out your census questionnaires. Go to 2020census.gov, get it done. If you know anybody, if you've done it, this is a very important part I want to leave everybody with. If you've done it, or if you know your mom's done it or your grandma's done it, but they have an efficiency and they didn't count the person in the efficiency, tell them to go back and add that person. You can go back online and add anybody you forgot. We don't want to leave anybody unaccounted for. We want all our money to come here, and we want all the representation.
You know, it's funny. It's interesting you mentioned the census, because I incorporated the census into my course online by giving the students a quiz on the census. It's called the census quiz. You know, at Miami-Dade College, you know, we're pushing the student to do wherever they live, and we know a lot of our students live in the city of North Miami. So if you are listening, I encourage all of you to please complete your census, because we need the resources to come right back to the city so they can help the people the residents who need it the most. Thank you.
Thank you. Thank you.
Okay.
Thank you so much, everyone. Just want to remind anyone listening that we are going to have a back to school for residents of North Miami, and it's going to be Sunday the 23rd. Look out for any other information. Outside of that, thank you so much, ladies, and have a great evening.
Bye-bye. Take care now. Stay
Bye-bye.
safe and keep your mask on.
I will.
Okay, bye-bye.
Bye.